This conference will now be recorded.
Oh, all right, so we're all in.
Ready to go?
Okay, Doc, yeah, Dr. Gottsay said he was coming. Told me that yesterday.
Yeah, I didn't hear from him.
No, I did.
So
I was told he's back in.
we're recording, right?
I never tell you I'm coming.
He's
We're-
back.
we're on?
If I don't tell you,
so.
if I tell you, I'm not.
All right.
Well, that's actually
6:30.
important.
I'll always be here.
It is recorded.
All right. Well, I'd like to start the June 11th Board of Health meeting. It's now 6:30. We'd first like to congratulate Gail Camarosa for
Thank you.
back to the Board of Health,
Yeah.
winning her election.
Return engagement.
Yeah.
Great. And Jim Potter.
And Jim Potter.
Yeah.
And Jim Potter as
Yeah.
well.
Appreciate it. Thank you. Thank you.
Gail got about 8 times as many votes as
Yeah.
you
Yeah, because someone didn't pass the word around.
did. Well, it wasn't my fault.
All right.
I
Our
got more
first.
votes than I did.
Our first appointment is 532 Franklin Street. Sandy Walsh is the owner. Neil Jackson's looking for a reduction in setback from 100 feet from wetlands to 72 feet.
I don't think we have anybody here. Roger's not here. This was filed with conservation.
Yeah.
On their agenda for June 9th. And Roger was fine with it. It meets, I think Title V is 50, our regulations, your regulations
Right.
say 100.
Right.
So
It's a federal
Yeah.
variance, but not states. Right.
right.
Now, there was no mention of, I know it's just strictly for wetlands, but there was no issue with the well being within 100 feet of a well or anything like that, so that's never a question. Okay. Anybody have any discussion on that?
Well, is there,
Yeah, I guess just the context, why is there, this is an existing property.
It's existing, yes.
And Roger's okay with it and the Concom is okay
Yeah,
with it.
he's okay with it. These are the plans so that you can.
Oh, yeah.
Around.
We actually have
stuff.
Oh, you have it, okay.
at least some of it.
Oh,
So,
I didn't get it on
Okay,
mine.
I guess to move this along, I move to accept the request for reduction in setback at 532 Franklin Street.
I get a second. All right. Let's do roll call. All in favor?
Aye.
Aye.
Just a question, we had discussed a year or two ago, the possibility if all of the pieces are in place, that they don't have to come before this board. And there were some questions regarding, whether Concom was involved and stuff. But we could, in principle, perhaps have a checklist which would allow Andrea to certify it without us. I mean, I think you had actually proposed that to us. Am I wrong?
not for local upgrade
Not for local
approvals or
upgrade.
variances, just for, I think at the time, I don't know if all the plans were going before the board,
Mm.
or it would have been for an emergency
Yeah.
situation where they needed to, it's a failure, they
Couldn't
needed
wait.
to have the plans approved so they could move forward. If myself or Roger was looking at them and we didn't see any issues, and we would have been recommending that the board approve them anyways, instead of waiting until the next board meeting or holding an emergency board meeting, we could just approve them
you-
and then put them on the agenda at. the
Yeah, but
next
you've
board
been doing that all along, haven't you? You have emergency
For
powers.
some of them,
Sure,
yes,
for
for some of them,
All right,
but
well,
not all of them
okay.
for emergencies, I've done that a couple of times. And then
So,
Mhm.
you let the board know at the board meeting and.
Right.
okay, all right, so we'll just leave it the way it is, I guess.
Yeah.
Okay.
All right, so that is it for our appointments. We have discussion items now. The first one is the new meeting date and time, if whether or not we're willing to change that at this point.
I guess I
Any
would say,
discussion?
yeah,
I don't know if it helps to have the background. I apologize. It's kind of based on my request to Andrea just to have it on the agenda, because I'm also recently been appointed as a member of the Board of Trustees for the Clapp Library, and they meet on the second Wednesday of the month at 6 o'clock. And I know this group has traditionally been meeting on the second Wednesday of the month at 6:30. I guess I would say a couple of things. I'm not looking to, if this turns out that it's really, a significant challenge. I know that staff obviously have other Board of Health meetings that they need to go to each month. But that's where it sort of originates from. So I don't know if for, current board members, I guess one thought I had is, it's just that it conflicts at that actual second Wednesday. Is there, I think Ware has a Wednesday meeting as well, but if you want to keep it to a Wednesday, is there another Wednesday that's doable?
Very limited.
Very limited, yeah, based on space as well in terms of, yeah, that's-
The select board's office for
yeah.
meeting rooms and times.
So that's another consideration. You're right, Mary. Thank you for,
How long are your meetings at the library?
they are probably generally till about 7:30.
Oh, but sometimes, I mean, I was on that board, I guess, ex officio years ago. I mean, sometimes they can go really long. And
Sometimes
have
they
some
can.
real issues.
Depending upon,
Um,
like any meeting, like
Right,
this meeting
right,
too, it
okay.
may be shorter
Um,
on certain days.
I would be reluctant to change it without Dave here.
I know, right.
This was, I mean, he used to have a problem getting here even at 6:30, but now he doesn't have his practice. So, but I think we should have some kind of consensus. Could I suggest that maybe you do a poll and see what alternatives there are? It's even possible the library could change, because they don't meet here, they meet in the library.
They meet in the library, right,
In
but,
your packet,
right, we have that meeting calendar,
Just the
you know.
everything, dates and times that are available.
Right, but we don't have Dave here. We don't have Dave sitting here at the moment.
Right.
So I just mean for the next meeting, you could do a email poll and see if there's alternatives. I mean, does it have to be Wednesday?
Well, it
Well,
used to be Monday.
it looks like, as Mary noted, there's certain days, obviously, town hall looks, is kind of busier on certain days than others, and it does look like, Tuesdays and Wednesdays on that meeting calendar are pretty busy, particularly for this meeting room, very frequently used in the evening.
We used to be Monday. There was, conflict with you, maybe with another board of health.
That's on Wednesday. the
No, I
first.
think that was during the pandemic. It was in the context that we wanted to meet with the select board. And that was the reason we moved.
We changed to Wednesdays because of another board member.
Okay, who's not on the board
Oh, okay.
anymore. So maybe you could just
So-
give us some options, send it out to all of us and see.
I mean,
The options are right in front of you on the
Right,
calendar.
on that calendar.
So it's, I
Well, what about Thursdays?
I was gonna say second
What's-
Thursday.
What's the problem?
the second Thursday
Oh,
is
right.
a Pelham
Okay.
Board of Health meeting,
Oh,
and then
that's right.
the Wednesdays don't work, because I have a Royalston Board of Health meeting on the first. We're typically here on the second, and then the third Wednesday is where, so I think
Zoning
Wednesdays
board,
out of the
yeah.
Wednesday
question.
out, yeah.
But as far as Thursdays,
Well, but
the
Mary,
first Thursday is fine.
Mary, what days do you work?
Monday, Wednesday, Friday.
Okay, nobody wants Friday.
Oh, she's not here on Thursday.
Yeah,
Monday could be, it could be 6:30. I don't know how long the creative economy.
I know, how long does that creative economy group meet? So, select boards in this room, first and third, like you said, Colleen, second,
Or the fourth?
or the fourth Monday, would that, a fourth Monday?
It's,
I don't know
con-
that,
well, it's in the
Concom
auditorium.
meets the fourth Monday, but they
Oh,
don't
it's in
meet
the-
here, it
But they're in
says.
the auditorium, it looks like,
That's what it says.
right. So then that
But
keeps
I
us clear from the select board, and then that, if that creative economy committee.
We're on the second, actually.
So the second, so if we did fourth Monday, I agree with you. I mean, I don't want to, have anybody make any changes, unless it works for all board members and staff. And I've already told the library folks that, we appreciate you all even considering making a change just because of my schedule conflict. But if it really doesn't work for this board and this group, to me, an elected office has to be prioritized. I would go back to the library people and they might have to reconsider where they're at, but,
Oh, we could make it tentatively that fourth Monday.
that fourth
Check with
Monday,
Dave.
yeah, check with Dave.
Check with Dave.
So same time, 6 o'clock, 6:30, I mean.
Yeah.
So fourth Monday at 6:30 PM, get in touch with Dave and make sure he
Just
can do that.
confirm with him.
Or maybe even
Exactly.
earlier.
Can Dave do earlier? I thought he was limited to 6.
Because he
That he
was
was
having
working.
medical practice, but he's now
He's retired now,
mostly
so we
retired.
can,
Oh, is he retired?
we can go
Oh, I
back
didn't
to
know that.
to
Okay.
6. Yeah, we can maybe go back to 6 o'clock. Yeah,
I mean, there's some boards that meet in the morning. I mean, some boards of health, in other towns. But that's a whole nother thing.
Right, but you all could do 6?
We can.
Also, we'll check with Dave and.
All right, so we'll check with David then. Thank you all. I appreciate the even considering it. And like I said, Andrea, particularly as you're,
Give you
if it gets to be too big of a hassle.
Give you an earlier evening.
Okay.
perfect. Our second discussion item is the fiscal year 2026 board to reorganize the chair, vice chair, and single signatory.
Okay, Mr. Acting Chair, who's still the vice chair, which is why you're sitting there. Trying to go through the traditional rotation, I would like to nominate Jim as the chair for the next 12 months.
Second that.
Take a minute.
There's no second, is there? Did you second?
You
it?
seconded, yeah,
Oh,
Colleen seconded,
okay.
All right,
Let's have debate.
all in favor?
Aye.
Aye,
Aye,
okay, that works.
great.
Vice chair.
And I think the person longest on this board who has not been there before would be Dr. Dave Kotsagan, so I nominate him for vice chair.
I'll second that.
All in favor?
Yeah, all in favor for Dave?
For Dave as vice chair, aye, I'm in favor.
Aye.
And I volunteer to be the signatory. In some places, that's the third ranking job,
Yeah.
but,
Are you in the signatory election?
yeah, that's just, you can call me up and I usually can come,
You can come and do it.
unless somebody else wants it.
You got it.
I think I've done that twice.
So just the Beatles.
Oh, we need a vote.
Yep.
I was gonna say, so
Yep.
then we nominate you.
Yep. I'll second
Nominated
that.
yourself.
And all in favor?
Aye.
The Beatles song, just call me up.
All right, that takes care of that discussion item. Number 3 is the fiscal year 2026. Approve the following appointments. Andrea Creek for Director of Public Health. John Presnall for Code Enforcement Officer. The Administrative Assistant is vacant. Mary Greener for Senior Clerk. Kristen Krieger, RN for Public Health Nurse. Roger Bacon for Title V Independent Consult. Terry Camerlin for Burial Agent. Jennifer Cody, Assistant Burial Agent. Dr. Scott Siege, Physician Advisor. David Fredenberg Jr. for Plumbing and Gas Inspector. And Mike McCain for Assistant Plumbing and Gas Inspector.
All right, I move that we approve that, and I had some questions. I guess we need a second.
I'll second.
First, Terry and Jennifer, I guess, are the town clerk and the assistant town clerk, and that's traditionally been the burial agents. And a incredible story from Bill Barnett once about chasing a hearse on the highway. But, I wanted to ask about Roger. Roger's not an employee, right? He's a consultant.
Right.
Is this appropriate for him to have the title?
Well, it's appropriate to, appoint him, because you're appointing him, the staff to do work on behalf of the Board of Health in Belchertown.
Okay.
This is a paid consultant.
Yes.
So, and then how are we doing with the administrative assistant? Do we have all those?
It's not advertised yet. We'll be discussing it at our board meeting coming up on Monday.
All in favor of those minutes?
Yeah.
Go ahead,
All-
you're the
all-
chair. You're the
Any
full
other
chair.
discussion? Yeah, any other discussion on this?
Can I just ask a quick
Yes.
question? I know Dr. Siege from previous work. He's still in the area. Is he retired as well, or is he's still working? Good for him. Great. Cool. Good guy.
In my now 5 years, I've never met him.
Yeah?
Yeah.
He's a dedicated physician. Not surprising, he's still working. Great, thanks.
All right, can I get a roll call vote on accepting these following appointments?
You need a roll call?
Or maybe not roll call, just,
I realize this is your first.
Yeah.
Your first time,
in a while.
first vote.
Roll call, all in favor?
Aye.
Aye. All right, fourth discussion is the Quabbin Health District town assessment formula proposed updates.
I was hoping Steve would be here.
There he is.
Hey, hey,
Congratulations on your election as vice chair of
if
the
you're
board.
late, you get a
Oh, welcome.
How are you?
Yes, sorry. Welcome.
All right,
Okay.
I thought Steve would be here.
yeah,
Well, Ken wanted this on the agenda.
Yeah, I just didn't want people suddenly to show up on at the Quabbin Health District board meeting and have this thrown at them without a conversation.
Right, we discussed it at our last district board meeting, but it got tabled. So we'll be discussing it, and voting on Monday, at the Monday district board meeting. So basically, the member town assessments haven't been changed since like 97. Belchertown has been paying 50% this whole time, Ware 45 and Pelham 5. Historically, it's been based on population size. Population numbers have changed since then, and however, the annual assessments were never updated whenever the new population censuses came out. So I thought it is probably time, well overdue, to relook at the assessments. And I did a comparison to show the last average 4 years of work in the district per town, and that's all, those numbers are all come from your annual town reports. So if you pull the Belchertown annual town report or Ware or Pelham for those years, you'd see the total number of inspections. So I did those to find out what that average would be over the last 4 years, if you were to decide that you wanted to base the assessments on work. However, each year, the work level can change.
Right, right.
I don't think it would change significantly, but it can change. So we did it based on the 4-year average. An assessment for Belchertown would be 55%, Pelham would stay at 5%, and Ware 40%. Versus if we did this based on population size, with the 2020 census, Belchertown is 57% of the population total in the district. Pelham remains at 5%, and Ware would be 38%. I personally think it's cleaner to do it based on population, since that's what was done in the past. But again, it would be up to the Quabbin Health District Board to decide, on the formula, if they want to change the formula or keep it based on population. And then the other part of the discussion is if the board collectively did want to change those assessments, when would you want that to go into effect? October, we typically, in our Quabbin Health District meeting, we go over the next year's budget. So I'll be putting together the 2026 budget in October for the district board to vote on. So at that point, the assessments could change for that year. That's why I was hoping Steve or, Jill would be here, because, I don't know what the town's financials are, and if, a 7% increase, which when we did the math, it worked out to be like, if that increase were to be for the 2025 budget that we have, it'd be like $27,000 extra.
Right.
So I would think you're probably looking at close to $30,000 more. If I was to kind of do a rough estimate for 2026, and we implemented that 57% for 2026, it'd probably be close to a 30,000 increase from what you would have paid if it stayed 50%.
Jim? So, I mean, we're not voting on this now. We'll be voting on it in Quabbin. And one thing I did not want is us to show up and the people from Ware and the people from Pelham vote for it and we vote against it. I think that would look horrendous. Because it is an increase for us and I guess a decrease for Ware, and it would be the same for Pelham.
Same for Pelham.
So I did research this and I found that the numbers that we've been working on based on population were accurate in 1990, which is 35 years ago, folks.
Yeesh. Let's say that.
I hate to think of that.
Yeah.
The first George Bush was president at the time. And Belchertown's increased in population, not both specifically and individually. The other two towns have remained basically constant in those 35 years. So it does seem to me fair, and so I kind of came around to agreeing it. Plus, you had conversations with Steve and Jill, and they didn't seem to.
But that was like a year ago. But also thinking about just even the workload from then until now, Belchertown has grown. Ware's kind of stayed relatively the same. There's a lot more growth in Belchertown over those years as well.
Can somebody remind me what's the time frame for your fiscal year for the Quabbin Health District? Is it calendar year? It is calendar year still, okay.
And that mostly makes sense because of grants and stuff, I guess. Doesn't it?
Our grants are fiscal
Their
year.
fiscal year, the grants.
So why on earth do we do, just because we always have?
There's in the Mass General Laws, Chapter 111, I want to say it's 27B is where I had read it. It does say when the budget for a health district is put together, and it mentions December for that next calendar year. So it's a Mass General Law that kind of dictates.
So by somebody who wasn't paying attention when
Right.
they wrote the legislation.
For some, it's just not practical, but
Yeah.
it seems like we've tried to stick with the Mass General Laws
Oh.
and doing what it says, so that's why it's historically been calendar year instead of fiscal.
So, well, this meeting, I think.
We'll be voting at the Quabbin District, not tonight, but I just wanted us to have a conversation before we start getting yelled at.
But I did let Steve and Jill know about the district board meeting too, and that we would be having that discussion, and I encouraged them, either one or both, to attend, so, hopefully, one of them will attend.
Okay, that was what I wanted.
Yep. Any other discussion on that?
I think that was
No.
as much as we can do.
Yeah.
Just to bring to our attention.
All right, our last discussion item is the Kratom update. Andrea?
Ken wanted it on the agenda.
I have information on this. Okay, so, because I was asking about this. So back in January 2024, which is 17 months ago, Belchertown became the first municipality, our board voted, I think unanimously, to,
No, I think Liam was opposed.
I thought that-
Opposed.
okay, in any case, our board voted overwhelmingly to ban Kratom in our community. At the time, there was one nicotine vendor, one licensee who was selling it at the time. We were the first, and being the first, I guess, takes courage, at least in politics, which is what this board is, as opposed to health. It was not until, I have the date here, no, until December that the second municipality in Massachusetts passed a ban. That was the city of Lowell. And I just learned a few days ago that since then, in 2025, 3 other municipalities, Chelmsford, Draycott, and I believe Westwood, which I wasn't able to confirm, have also passed it, which means that as of today, there are 5 municipalities that have passed it following our leadership, with over 216,000 people in those 5 towns.
And Ken, can I just ask, this is a total ban, this has no age, you didn't
Right.
talk at all about
Right.
age. This is a total ban, no
Yeah.
sales whatsoever when you all
Right.
passed your, and the other communities are the same? Or do they
I
have
believe,
age?
I believe that's correct.
Okay.
Now, we'll talk a minute about nicotine-free generation also, which I want to talk about, but in Kratom, we were the first municipality in Massachusetts, but there are 6 states that have banned it completely. And it's an interesting list because it includes Vermont, which is probably the most liberal state in the country, and it includes Alabama, which is probably the most conservative state in the country. So this is not a
Yeah.
typical left-right, Democratic, Republican kind of thing. It's kind of interesting. There's bills in the legislature to ban it completely, and that'll take perhaps decades before the legislature gets its act in order. The way that happens is you get enough towns to do it, and then they start to pay attention. I was told, I haven't had any communication, there's the one person working on this in the state is a woman whose son died. And she's going town to town and trying to get them to ban Kratom, but good luck to her, and, if she asks for our help, maybe we can provide that, but, so we were first, and it's now
Good.
moving along.
Yeah.
If I may.
Yeah.
Talk
Roll right
about
in.
nicotine-free generation, which in contrast to having one person working on it, there are several dozen of us working on nicotine-free generation. There are now 17 municipalities that have passed it. In the last few months, that includes the city of Newton, the town of Hopkinton, which is where the Boston Marathon begins, city of Somerville, and locally, Pelham passed it. Now, you might remember Pelham passed a resolution in January,
Right.
but they now have adopted under Andrea's leadership a full tobacco regulation. That includes nicotine-free generation. That was, I guess, in May. And in addition to that, Conway becomes the first municipality in Franklin County to approve it, and they also did that in May. And we're working on some others, but
Yeah, South Hadley, I went to their meeting, they put it on the agenda, and everyone in the Board of Health is definitely for it, on the new Board of Health.
and I was there last night, and
Oh,
they
you were there.
confirmed that.
Oh,
And
good.
So they're.
your friend is the new chair, and she's very enthusiastic.
Who's,
Zia?
she's
She's
just
the new
PO,
chair.
PO, I forget her first name.
When do they plan to vote?
I know, when are they gonna do the?
I don't know, they turned,
They have to do it here.
Sharon Hart, their
Next month.
director, turned it over to their town council, and it's been sitting there. We had a law professor who apparently called yesterday to say he'd help with moving it along. But I'm guessing it's over the summer, they'll want to have a public hearing. Some towns don't like to have public hearings in the summer, so,
Yeah,
but
I
it'll
think
be
they'll do it.
soon,
Yeah.
and we have the votes, and
And
there are a bunch
Amherst
of
is,
other towns we're working on.
Amherst was, they were like having their discussions.
That's good.
Yeah. They were
So,
Discussing it, right, Ken, they were like up in the air in Amherst. There were pros and cons.
it's like the big towns say, we're worrying about the little towns worry about the big towns.
Yeah.
This is all politics.
Yeah.
This has nothing to do with public health.
Mhm.
Everybody knows that nicotine is the most dangerous substance in terms of the number of people who are killed by it.
Mhm.
And, it's a good idea, but we have more important things to think about. Oh, yeah, like what?
Mhm.
Title V,
Yeah.
It's just,
Yeah.
it just astonishes me, the answers. People talk about freedom of choice, but they don't talk about freedom of choice with asbestos,
Right.
which used to be widely available and now is illegal for everybody. They don't talk about freedom of choice.
Well, even freedom of choice when you're addicted. When you're
Right,
addicted,
when
that
the
freedom of choice
is
is taken
gone.
It's
away.
gone.
But that is what big tobacco and their puppets here in Massachusetts use, and I've been spending
Their
money
playbook for the
to
last
do that.
Yeah.
multiple decades.
Yeah.
Yeah,
Yeah.
it's not new. but-
Anyway, thanks to the other members of the board who've been involved in this, and we're gonna continue rolling it along.
rolling
There are
it.
a bunch of other towns, but I'm not gonna mention their names until they wanna say they're for it.
Very
So,
good.
thank you. Oh, the number of town, by the way, the
Oh.
population of those 17 municipalities that have already banned it is 574,000. So
Wow.
we're talking about a
Wow.
lot of people, but
Wow.
of course, a tiny fraction of them are affected because it's only
Wow.
people
Yeah.
who were born after 2004.
It'll change with each time when they pass it,
Well.
the year will change it.
Yeah.
And thank you, Andrea, for your leadership in this.
Thank you.
All right.
Now that, Dave's here, we can ask about the new meeting change.
Oh, yeah.
If we change the Board of Health meetings to the fourth Monday at 6 PM, are you able to make those?
The fourth Monday at 6 p.m. Yes, except. Fourth Monday.
But not this month,
Yeah, not this month, yeah.
start of
Um,
July.
Yeah, so I know I can't make it in August or September. Is the problem. Yeah, I mean, in general, it's good, except for August and September. Yeah,
Is it just that particular date or the time?
just those particular dates, because I'm just away.
Well, let's go with it.
Yeah. Yeah.
That way Gail can continue on the library.
Okay, if that works for everybody?
Yeah, is that
Thank you.
better for you, Gail?
It's
Yeah.
better for me, I had a one with the schedule.
Monday at 6.
General, it's
So, fourth
Just as-
Monday at
just as-
6 PM.
so next, so July.
I did hear back from Steve, he did send me a text message, he had a change of plans, otherwise he did plan to come, but, he said that he spoke to Joe, who's your town accountant, and he said that they accounted for an increase, so they are all set if the board
So
approves the change.
They're good
Oh,
with
and the
that.
budget we
Six,
passed
six,
last time,
Six,
last week.
Six, yeah, it sounds like 6 o'clock is
6
what,
p.m.
But I'll
fourth
still,
Monday at
Yeah.
6
And
PM.
because it would only be
Yeah.
half a year now, but it
Right.
would be going forward.
Right.
Hopefully they don't ask for a refund on the past year's over.
Oh,
Actually, the three offices, which includes me, of the Quabbin Health District met, and there was talk about that, and that's when I pulled out my semi-automatic. Retroactive, it wouldn't be to 1990, it would only be to, say, 2000, so it's only 25 years worth.
That's all.
Quabbin. Yeah.
That's all.
Time size, 27,000.
All right, well, that takes care of our discussion items. We can go to regular business. Review and approve the May 12th meeting minutes.
I move that we approve them as presented. I actually read them.
Yeah. All in favor?
Yeah, South Hadley, they were people who said they wouldn't vote because they hadn't bothered to read them.
Really?
Honest, yeah, they were congratulated for their honesty.
Other additions to the agenda?
Oh, the warrant.
We have a,
Is there a
we
warrant?
have a warrant to sign or no?
Yes.
Okay.
I have a question. I mean, some boards don't meet both months in the summer or even at all. We certainly would want to meet if there's a request for an exemption or something, but it's something to consider, I guess, in consultation with our new chair.
So we have a Spectrum phone for $53.34. We have an Amazon Capital Service for $852.95, and a WB Mason office supplies for $317.26, for a total of $1,224.55.
We never vote on this, but probably was supposed to. I had that conversation when I was on the select board. So they would vote on that alternate. They'd meet it every other week, so they only vote on it every other week, and the other times they would just sign it. There you go.
Thank you.
I mean, these are appropriations, they really should.
Yeah.
I know, when I was on the board before, we actually did used to vote on them,
Yeah,
but kind of.
this actually is a real amount of money. Sometimes it's
Yeah.
$3.
Yeah.
Just a quick update for 248 Amherst Road, about that at our
Oh,
last
yeah.
board meeting. I did speak with the property owner, the property's listed on Zillow already. And they are looking to install the new septic system in July, and that's actually stated in the description, with the listing. Roger and John went out recently to take a look to see if there was any evidence of failure or breakout, and there was none. So I'll check back in mid-July and just make sure things are moving forward with the new install.
Perfect.
And that was one of the most difficult ones we've had.
Most
That and
prolonged
Dressel.
ones.
That and Dressel
Yeah.
was,
Very prolonged anyways.
that one was, we had to condemn
Yeah.
that one.
Yeah.
That was an active failure, like
Yeah.
coming up out of the
Yeah.
ground, running down the road. And, it was just a single family house that
Yeah.
they were renting, and the bank was taking over, so we had to deal with the bank and.
All those players
Yeah,
involved,
so,
yeah.
but that's resolved,
Good.
thankfully.
Oh, and the appointments, the animal agent is like April, and we did that back in March, why is that off?
It's probably another
That's
mass
general law thing, I think too. I think it's another, yeah, it seems out of
Can't make it
sequence,
easy.
but-
Yeah.
Yeah.
Same thing with some of the permit fees, like
Fees,
from
yeah.
certain manufacturers, and
Oh,
it's not January
I
first.
know, wouldn't it be nice if it all lined up?
Yeah, but it's just mass general law.
Yeah.
Even some of the permit fees are set really low in the mass general laws. And I've been talking to, people with the Mass Health Officers Association to see like, what can we do? Because like, nobody is following a lot of those fees. because it's just not practical. The amount of work that's involved in doing like a recreational camp inspection to charge a $10 fee, it's just, no, the regulations are very extensive and those regulations didn't exist back then. So it hurts the towns too, because you think about the work that goes in, that's involved in it, even the training. It's not $10, you know, you're not getting what the work is, it's not equivalent. So, as long as nobody pushes back, we, in one of our towns, we had changed the fee schedule and it was for mobile home parks. And we set it for 125, and the Mass General Law, I believe, is either 25 or 50, I can't remember. Mobile Home Park Association caught that, and they pushed
Wow.
back.
And then pushed
We
back
can't,
and you
we
couldn't.
had to
Wow.
charge them the Mass General Law fee, but then that's triggering, like, you know, I don't know anybody that's, you know, with that fee.
Mhm.
So there's discussions on, you know, at
At
the
the higher
DPH
levels,
level,
yeah,
the
right,
state level,
right.
just relooking at some of these Mass General laws, the fees, just to
That are
see what
outdated,
could be changed, because, you know, if they took a survey, they would find very, very small percentage are actually adhering to those very low fees. And if everybody had to change them now, you'd be significantly reducing
Right.
your revenue.
You're right, right.
Right.
So,
Just like the Mass General Law calls for to improve, and I'm getting, sorry, I was late, is the reappointments happen now. Yeah. And I asked before, I think, what does the physician advisor do?
I believe they do like standing orders, if we're going to
Standing
do
orders.
vaccination clinics in town.
The standing orders.
They do standing orders, and Kirsten, our public health nurse, works with them.
Okay, you laugh.
Do you know
chuckle.
Scott?
No.
Scott's a pediatrician as well.
Oh, well, okay.
Yeah, practiced in Ware for the longest time.
Oh, okay. No. Great, okay. Good to know.
All right. Someone like to?
No, I'm having fun. I don't want to adjourn.
I make a motion that we adjourn the June meeting.
Give a second. Gail?
Gail second.
All right.
Right.
All in favor?
Aye.
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 Thank you.
Meeting is adjourned.
I won't be here in July.